I'm sure everybody's familiar with this old commercial.
Okay, last time. This is drugs. This is your brain on drugs. Any questions?
Okay, no questions, right? No, I'm just kidding. I'm sure you have questions. I had a lot of questions, and I still have a lot of questions. Like, what really happens to your brain on drugs, and what occurs between every neuron and all the receptors on the neuron. I'm sure everybody here is familiar with the fact that drugs cause long-term brain damage. But my initial question was, when somebody starts taking drugs chronically, is all hope lost for them, or do they have a chance at recovery? So about 2 years ago, my family was at my grandparents' house. They live near Tamarack, and my dad and my brother were leaving the house, and they noticed a car pulling up near their neighbor's driveway, and they saw a male passenger and a female passenger dragging out an unresponsive male. And they went over and saw if they needed any help, and they didn't really know what to do or how to help because this guy was unresponsive. And my dad remembers it being a scorching hot day, like 90 to 95 degrees, and he felt bad for him because his head was on the dirt. So they got him water, and they got him a pillow for his head, but they didn't really know what else to do. And about 15 minutes later, an ambulance came, and the guy was overdosing on heroin. They gave him Narcan, and my parents remembered him sitting up. But he could have overdosed a week later or even a day later because of how addicting heroin is. So I really wanted to understand why heroin was such an addicting drug, and I wanted to explain it to you guys the best that I could. But in order to do that, we kind of have to understand a little bit about pain. So imagine you're hiking in Yellowstone National Park, and you get attacked by a grizzly bear, and you manage to get out of the situation safely. Later that day, you're going to calm down, your body's going to go back from its sympathetic state to its parasympathetic state, and your immune system's going to start to heal the scratch mark, and your brain is going to produce naturally occurring opioids called endorphins to damp down the pain. But say you have more of a chronic pain, like a crushing leg injury. Every hour and every day, you're going to have shooting signals to your brain of pain, and your natural endorphins aren't going to be enough to damp this down. So your doctor may prescribe you a painkiller like morphine, hydrocodone, oxycodone, and this artificial painkiller is going to land the same place where your naturally produced endorphins land, which is on the end of your nerve cell, where your neurotransmitters also act. Neurotransmitters are just chemical messengers such as dopamine and serotonin, and once neurotransmitters act, signals are going to go from neuron to neuron until it reaches a certain point, and this is going to allow you to feel pain. But when opioids are present, this signaling doesn't happen, and pain is blocked, which sounds like a good thing, but it's not really a good thing. So when heroin enters the body, it's quickly broken down to a lot of chemicals, one of them being morphine, 6-acetylmorphine, and this morphine binds to mu receptors. This is a mu receptor, and to emphasize how important it is, without mu receptors in your body, you would have no response at all to any opioid drugs. So first, one part of the brain that has a lot of these mu receptors is the midbrain, and this midbrain is typically associated with receiving pain, and it has specialized neurons called GABAergic neurons, or G neurons for short, and these neurons are responsible for acting as off switches for the pleasure networks of the brain. But when opioids are present, they can't act as off switches because they inhibit them from doing this, so your pleasure and euphoria networks are always on. The next part of the brain I want to talk about is the part that manages stress and anxiety, and it's called the amygdala. Also, when opioids are present in this part of the brain, inherently you're going to feel less stress and anxiety. So that all sounds good, but it's not, because your brain's going to adapt to the drugs really quickly, and you have a very delicate balance of neurotransmitters, so when it's thrown off, your brain's going to stop producing serotonin, dopamine, and other neurotransmitters naturally. And this just causes the user to not be able to experience pleasure in a normal way that they typically would. So chemically, what's going on is each neuron has a certain amount of receptors on it, and when flooded with dopamine, it's going to try to compensate for this. And it does it in a lot of ways, but I'm going to talk about 3 main ways. The first one being desensitization, which is basically your receptors just becoming less sensitive or less responsive to the influx of dopamine or the drug coming in. I think about it like having a favorite food, and then you eat it more and more and more, and it becomes less appealing and tasteful as the first time. And the second way that I'm going to talk about is downregulation, which is reducing the amount of receptors on the neuron. And this is basically just another way of your brain trying to compensate for the huge influx of drugs coming in. And the third way is upregulation, which is the opposite of downregulation. It's an increase in the amount of receptors. And an easier way to think about it is like your body's trying to catch all the dopamine coming in, but this causes extreme dependency because say the next day you go to do something, like you see a baby or you eat food, you're going to get dopamine, but your body's only going to catch a little bit of it, and you're not going to feel any type of typical pleasure that somebody not on drugs would. So all of this basically just means that a user of a drug like heroin or any opioid is going to feel less pleasure from daily activities or daily tasks, and it's going to be hard for them to manage daily life without the drug. Also, as an opioid disorder progresses, they're going to need more and more and more of the drug to keep withdrawal at bay, and that's when addiction is set in. The last part of the brain that I want to talk about is the part that manages awakefulness and alertfulness. And when opioids are present in your system, your blood pressure is going to decrease, your heart rate is going to decrease, your alertfulness, and your respiration. And your respiration decreasing is very dangerous because if you're not getting oxygen to your body, you're not getting oxygen to your essential organs like your heart, your liver, and your brain, and that can cause permanent damage. But also, the more opioids someone takes, the less they're going to respirate, and the less you respirate, it just continues to less respirate until you get to a point where it just stops, and that would mean death. So that's an overview of your brain on drugs. It's more complex than the video, but to answer my initial question, if all hope is lost for people who start taking drugs of this nature, the answer is no, because of up-and-coming therapies such as opioid replacement therapy. And this is basically where the patient would receive a different type of opioid, and it would stay in the brain longer to keep withdrawal at bay, and it would not damage receptors as much. And receptors have the ability to heal and regenerate, so this gives the 600,000 heroin addicts in the US a chance at recovering. Thank you.